Today we're going to talk about Corin OMNIBotics total knee arthroplasty with the Apex system. Here we're demonstrating placing navigation marker units on the shin and the femur of the patient and calibrating a dynamic infrared-based robotic alignment system. We're showing the patient's degree of instability with this image, showing the broad green lines and coming up with specific numbers for the patient's alignment prior to proceeding with any surgical cuts. In this image, we're targeting the tibial cut very precisely to within millimeters prior to proceeding with any type of cuts. We can perform the tibial cut and then place the OMNIBotic dynamic tensor in the knee to determine the femoral cuts based upon the tibial cut with the reflective marker system. We're taking the patient through a full range of motion with the knee and making sure that that femur matches the tibia before placing any components. This gets rid of the patient's flexion contracture and also allows us to get excellent full range of motion. This is the femoral robot attachment, which based upon the intraoperative planning shows that we're aligning the femoral cuts to match the tibial cut, provide very little pressure or tension within the joint, and will result in less pain and a faster recovery. This is calibration of the femoral component before performing any femoral cuts to make sure that the system allows us to match the femur to the tibia and again relieve pressure in the joint, provide overall improved limb alignment, and accelerate early postoperative recovery for the patient. This is the femoral robot assisting in the femoral cut, and then we're validating the femoral cuts now afterwards with a dynamic spacer in place, showing how we've improved the overall alignment and reduced the pressure in the joint. We're allowed to document in this situation that we've recreated a normal range of motion in this patient. The image on the left shows the preoperative instability in the patient and their range of motion prior to surgery. And the next image shows how we've corrected the overall limb alignment with substantial improvement in both alignment and stability. Much thinner green line shows that there's improved stability. The Corin OMNIBotics system allows us to have reproducible results in patients of all shapes and sizes.